Welcome back to Takeout, coming to you from New York. The Department of Health and Human Services is preparing a list of injuries it believes it can assert were presumptively caused by COVID vaccinations. Now, this list would allow people to be compensated for these injuries without, and this is interesting, to prove that the shot, meaning the vaccination, was the cause of said injuries. HHS Secretary Robert F. Kennedy, as you know, is not only behind this proposal, he's a longtime skeptic/critic of vaccinations, COVID and otherwise. Dr. Céline Gounder joins us to discuss it all. What is this list and how is it being propagated or put together?
So right now, if you think a COVID shot hurt you, you actually have to prove causation, and almost no one can. The government denies about 98% of these claims, and the new rule would actually flip that. So if your injury were on this list and it occurred within a specific time window, then it would be presumed to have caused the injury, and you would get compensated automatically.
So if I understand what you just said, Dr. Gounder, you got a vaccination in a window. There's a list of things you say, no, I got that. It's on the list. Therefore, I am eligible for compensation. And that's all that has to happen.
That's all that has to happen. And for a few specific injuries, it's actually overdue that we do this. So we know myocarditis, which is heart inflammation in young men. It's very rare, but it is a real side effect of these vaccinations. Severe allergic reactions we know can occur, again, very rarely. So people who have those documented injuries should get help without having to fight for it.
In general, for the other ones that don't fall into those distinct and already identified categories of injury, how unusual would it be to have a kind of compensation process that's this, let us say, informal?
Well, I think the concern is who is making the list. We do have a vaccine injury compensation program for childhood vaccinations, but the way in which conditions are put on that list is very scientifically rigorous. And we know Kennedy has spent years claiming that the COVID vaccine causes harms that the evidence does not support. By law, there should be strong medical proof to put these different conditions on the list. Timing alone should not be enough to say this caused it. Just because A happened before B does not mean A caused B. But we are concerned that this turns into coincidence being interpreted as cause.
And do we have any sense, Dr. Gounder, of what the amount of compensation could possibly be?
Well, it all depends on what's on this list.
I see.
One of our other concerns is with the childhood vaccines, if Kennedy puts autism on the list of childhood vaccinations as, potential condition caused by vaccinations, which there is no evidence for, but if he did that, that could bankrupt that injury compensation fund.
Wow. So as people are watching this, are there some time deadlines they should think about? Is this a summer and fall sort of situation? When are we going to know more about some of the things we have been discussing but don't know all the specifics about?
Yeah, so we think that in November we should have a much clearer sense of what's happening with this list. The thing that I'm going to be looking for is, does death appear on that list? And the program, to be clear, already pays death benefits when it's proven that the COVID vaccine has had something to do with somebody's death. But again, these are extremely rare incidents. The bigger concern is that this will signal to people that these conditions are truly due to the COVID vaccine. And we do not believe, again, to be clear, that most of what is likely to be proposed by Kennedy would fit into that category.
And very quickly, Dr. Gounder, in the public health space, I'm sure you have some nervousness that this entire conversation could increase overall vaccine hesitancy.
Yeah, and we're seeing measles rates, measles cases continue to go up. We're about to surpass the 2025 numbers. We're likely to lose our measles elimination status later this year. And all of this is feeding into this narrative of, are vaccines safe and effective? And to be clear, those that are licensed and available in the U.S., they are.
Dr. Céline Gounder, great stuff as always. Thank you so much.